My name is Aggie Cox. I'm the Government Affairs and Marketing Director for Hologic Australia and New Zealand. We're a women's health MedTech company specialising in early detection, diagnosis and treatment across diagnostics, gynae surgical and breast and skeletal health. My career started off in nursing, so I worked as a nurse for approximately 5 years across hospitals and in rooms. And it was during that time that I had an opportunity to actually interview for a sales position with a distributor MedTech company. And I decided to take that opportunity, and this led me down the path of sales, product management and ultimately marketing. I really truly found my passion in marketing when I had the opportunity to take the role on as a product manager. And I decided I wanted to go in and do some extra education. So through Melbourne Business School, I studied for a Masters of Marketing. And then during that program, I received my first sort of career opportunity at Baxter. My lecturer was a consultant for Baxter, and the way I was being taught to create strategic plans what he was putting forward at Baxter. So I was able to bring what I was learning at university into actual practice, which isn't always the case when you're studying. Baxter allowed me to network with a number of people, and MedTech is a very small community, and a lot of those people have ended up in different companies. And the opportunity that came up at Hologic was actually through a HR director that I worked with at Baxter, who is now here. So she had contacted me to ask me whether I might be interested in joining Hologic as a marketing director. And having a look at the portfolio, it really resonated with me, and I felt like my career and all the experience that I'd gathered over the years was really working up to this position, which, having had some experience in diagnostics with QIAGEN, having the experience in gynae surgery with Baxter, and the breast and skeletal space with Device, just seemed to all sort of fit together. In this role at Hologic as the Government Affairs and Marketing Director, it really allows me to help build awareness, which I really love. Obviously, my passion started in health and medicine, which is kind of where my journey was leading me, and now to get to do this on a different degree in an area where I can help bring awareness to particularly women in a various number of health conditions is extremely satisfying and really meets my purpose. I think for me there are three things that drive me and keep me happy at a company, I guess, is really people, the culture and the purpose, and I feel that I found all three here at Hologic. One other thing that I think is really important is being able to give back, and I do that via mentoring. So I've been very lucky throughout my career to have some really fantastic bosses that would advocate for me when I wasn't in the room, and I want to be able to do that for other young people coming through and to help their path. So at the moment I'm mentoring a young woman through the Australian Marketing Institute, and I'm really enjoying that experience. In addition to her, I'm also mentoring a young woman that I actually worked with at Baxter, and she came through into marketing, and now I've been able to see her flourish in that role here as a marketing manager and continuing to support her journey. One of the most rewarding projects that I've had an opportunity to work on was the Live Comfortably campaign. So we raised awareness of heavy menstrual bleeding. We did a survey of 5,000 women around Australia looking at their thoughts and opinions on menstrual health and heavy menstrual bleeding. And we found that 72% of women experience heavy bleeding, and that it takes 7 to 8 years for a woman to seek treatment if she realises that she has a problem. A lot of women put up with heavy bleeding and believe that it's just their lot in life and there's nothing that can be done. So working with patients, with clinicians and with Jana Pittman, we put together a campaign, and I have to say that was definitely one of the most rewarding things I've done to date, and the campaign reached far with 72 million impressions around the globe, and we had over 50,000 visitors to our Live Comfortably website within a period of 6 months. Hologic runs a global women's health index every year. We have for the last 5 years, so we've got 5 years of data now. It started in 2020, right before COVID was the first lot of data that was collected, and it was really our baseline. And we saw the trends across 5 dimensions really change over time, particularly the impact of COVID. The 5 dimensions that the report looks at are preventive health, emotional health, individual health, basic needs, and opinions on health and safety. The Hologic Global Women's data is collected yearly in conjunction with Gallup. We survey 145,000 people each year over 144 countries and territories in 140 languages. I think that the women's health burden is lifelong and systemic, and we're still seeing life events really funded as opposed to the whole women's lifespan. And what we found in the index was very similar to what you've been saying in regards to preventative health being largely undermet globally, chronic conditions also being underdiagnosed, and emotional health being neglected. So, you know, the other part I think is that when it comes to funding, we fund a lot of sort of treatment events, but there's not enough funding going into early diagnosis. Over the years, what we've seen, particularly in the last 4 years, is a trend downwards when it comes to preventive health. So women haven't been prioritising their preventive health across looking at their blood pressure, diabetes, cancer testing and STI. We haven't quite gotten back to those baseline levels of year one. Also, emotional health has been deteriorating. So we've seen a level of emotional health, women being more sad, angry, worried over the years. And we're seeing that basic needs have been impacted for women as well. So their ability to afford food and shelter, particularly. And Australia scored in the index 59. The global average was 54. So it was great that we scored above the global average. However, locally, we're seeing the dimensions declining over the last 5 years. Our emotional health has been deteriorating, and our stress actually scored higher than the global average for year 5. I think that preventive care and early detection is going to be so key across that life cycle. One other trend that we're seeing when it comes to the Hologic Global Women's Health Index is that more women are living with chronic pain than they were in previous years. And we're also seeing in regards to safety, particularly in Australia, only 54% of women feel safe walking alone at night in their communities, compared to some of the stats from our other comparator countries like the UK and the US, where the percentages are higher. And we have one of the largest disparities between men and women feeling safe walking alone at night. The Hologic Global Women's Health data for Year 5 for Australia, we will be officially releasing it in July this year, and it will coincide with a screening of the Conquering Breast Cancer documentary, which Hologic is a platinum presenting partner of. Coming in as a clinician into MedTech, you have a really unique lens, because you have been on the other side, and it's much easier, at least I found when I was first starting and moving into sales, to be able to communicate and understand the area that you're working in, whether it's theatre or whether it's rooms. I know there were days where a clinic would be busy, and understanding what that environment is like, having worked in there myself, I'd remove myself from the situation. And customers tended to appreciate that and the way that I interacted with them to allow our relationship to develop and that trust to develop. And I think also having the understanding and respect for the patient, and at the end of the day, the patient is the most important. So it did allow me that sort of unique lens in that space. And I use that throughout my career, even now as a marketing director, when I'm running these patient campaigns. I can lean back on that clinical experience on dealing with patients on the front line to be able to create something that resonates and hopefully makes a difference to their lived experience. My advice as a clinician moving into MedTech is finding a company and a purpose that resonates with you, whether it's working in women's health or whether it's working on particular products in a health space, is definitely the first thing, because I think if you can find that purpose, it really helps with the rest. And there's lots of companies around that seek particular experience from different areas that might work with some companies better than others.